right, and we have two doctors joining us here from Ontario. You're from Toronto, Dr.
Kakznov.
And from Peterborough, Ontario.
Dr. Kathiravilu.
Oh, well, thank you so much. How are you enjoying the conference?
Amazing. It's great. Yeah.
You know, how many patients would you see that have kidney disease or in early stages of diagnosis, percentage-wise?
I have a high immigrant population, so I think it's higher in my practice, so about 10 to 15%.
I probably have about 10%. I have a more senior practice, so it's a very geriatric heavy practice. So I do have a lot of, chronic kidney disease.
What are some of the high risk factors that you encounter with patients in your practice that are linked with kidney disease?
I think mainly the high-risk groups, so people with high blood pressure, people with diabetes, people with a family history. And I think that what I've learned through my years in practice is sometimes you just don't know. They have no risk factors, no symptoms, and they have early signs of kidney disease.
Right, touched upon that point. That's one of the difficulties that we struggle with Kidney Foundation is that there aren't a lot of warning signs. So when people are diagnosed, they're usually much, later stage, unfortunately, for us. How about yourself at your practice?
Yeah, same thing. I mean, it's the risk factors, as we know, the diabetes, the high blood pressure patients, the patients on chronic medications that can potentially affect the kidneys, family histories, obesity. But as Dr. Kakznov mentioned, most of it is asymptomatic. So you just pick it up on routine screening and people don't really have much warning signs until it's later in the disease. And so that's why it's something important, to have regular follow-up care with your family doctors and be screened.
Well, thank you so much. I know we're on a tight schedule. Grabbed you here before the conference starts again. Thank you so much for joining us on Plugged In.
Thank you.
Thank you.